Hey guys, this is Dr. Hub. Today we look at the speech audiometry. So speech audiometry, it consists of two components. So what are they? So first is the speech reception threshold. Next is going to be the speech discrimination score. Score. So let's look at each of them in detail. So first is, as we discussed, it was a speech reception threshold. So under this there is a minimal intensity. There is minimal intensity, and this is at which 50% of the words are repeated correctly. So at which there is 50% of the words. So here the 50% of the words, they are repeated correctly. They are repeated correctly. So it is repeated correctly by the patient. Next is the speech discrimination score. So the speech discrimination score. So what happens in the speech discrimination score? So the patient's ability to understand speech. So it basically the patient's ability to understand the speech. So let's look in more details. That is, there is percentage. The percentage of the phonetically balanced words. So percentage of the phonetically balanced words. So this is delivered. So this will be delivered at 30 dB. That is 30 decibels above the SRT. Above the SRT, and which is identified correctly. So it is identified, which is identified correctly. Next is in normal persons, in case of normal persons, and those with conductive and those with the conductive hearing loss. In case of hearing loss. So here there is a high score of, there is high score of the 90 to 100%. 90 to 100% it can be obtained. Next is if reduced in cochlear lesions. So it is reduced in case of the cochlea. Reduced in case of the cochlear lesions, and it is very poor. It is very poor and out of proportion, and it is out of proportion to the hearing loss. It is out of proportion to hearing loss. It is out of proportion to the hearing loss in the retrocochlear hearing loss. The retrocochlear hearing loss, and it can get bad or it can get worst in cases of the cortical deafness. In cases of the cortical deafness. Now we need to know an important phenomenon. It is known as a rollover phenomenon. So what happens in case of the rollover phenomenon? So this is nothing but a feature of the retrocochlear hearing loss. It's a feature of the retrocochlear hearing loss. Next is in case the speech intensity is increased. So in case the speech intensity, it is increased above a particular level, above a level, the STS falls. So the STS, it falls. It falls instead of maintaining a plateau. So instead of maintaining a plateau, it falls. Plateau, it falls. And as in the cochlear deafness. As in the cochlear deafness. Now, what will be the uses of this? So looking at the uses, it is to differentiate the organic. So you can differentiate organic versus the non-organic hearing loss. Hearing loss. Next is to differentiate the cochlear versus the retrocochlear lesions. And also to find the intensity. To find the intensity, this is at which the discrimination score is best. At which the discrimination score, this is best. It is best, which is useful for the fitting a hearing aid. For fitting a hearing aid. So now this was all about the speech audiometry. We learned about the components. We also saw about the rollover phenomenon, uses as well. To learn and grow daily like this, please do subscribe.